Bone is the second hardest natural substance in the body, composed of cells embedded in a matrix. Osteoblasts secrete this matrix and then become trapped inside the matrix in lacunae. They then become osteocytes. Osteocytes can revert back to be an osteoblast if needed to help form new bone in times of fracture. Osteoclasts remove bone where it is not needed, and this can help with the fracture repair called remodeling. And it also allows the blood serum levels of calcium to be increased by withdrawing calcium from the bones. So function of bones, support, the most basic function is to support the animal's body. So they serve as a scaffolding to support, and the rest of the body either hangs from bones or is directly attached to them. Protection, they protect vital organs and tissues by surrounding them, partially or completely. For example, the ribs are protecting the lungs, and the bones of the skull are protecting the brain. Um, Also, the eye orbit is protecting the eye and the delicate structures of the ear inside. For leverage, basically, the bones allow the muscles and joints to help the animal move around in its environment. For storage, they act as site for minerals, particularly calcium. So they can store calcium and either withdraw calcium when needed. And they also store bone marrow, which is blood cell formation or hematopoiesis. So that is how you say that word. Hemato meaning blood. Poiesis is the genesis. Um, so blood cell formation coming from the bone marrow. So bone structure, basically going to just do a voiceover for this for how to say some of these terms. Most of you said them correctly in your assignments, but periosteum, peri meaning outside, so a membrane that covers the outside surface, and endosteum, anything that's endo is inside. So that is the membrane that lines the hollow interior surface of the bone or the medulla where the bone marrow is kept. They are both fibrous tissues. Okay, again, so endo meaning inside or in, within. Endochondral bone formation. Chondro usually is referring to cartilage, just like the costochondral junctions. So this is a cartilage template that is replaced by bone. The primary growth center is the diaphysis. Second growth center is the epiphysis or epiphysis. It's usually epiphysis. And then the intramembranous bone formation is bone development from fibrous tissue membranes. Intra also kind of means inside, um, but this is only occurring in certain bones of the skull. So bone marrow, everyone has seen their bone marrow now with the joint assignment. There is red bone marrow, which has hematopoietic tissue. So tissue that creates red blood cells, again, hema meaning red blood cell, or sometimes just meaning red. Most common in younger animals, yellow bone marrow, primarily adipose connective tissue. Adipose meaning fat, so usually yellow bone marrow is fat, and that is found in adult animals. And when an animal is anemic and in need of blood supply, the yellow bone marrow can revert back to red bone marrow and become hematopoietic tissue once again and help that animal um, have red blood cell production from the bone marrow when they are in times of need. Just as a side note, the spleen also has hematopoietic tissue, so that is another place for red blood cells to be formed, and the spleen is a large organ to store red blood cells as well. For this one, again, basically just recording voiceover for pronunciation of some of these terms. So in this horse skeleton, we have the occipital bone at the back, the parietal bones, temporal bones, and frontal bones. For this slide, I left it in basically because there are, again, some words that are kind of hard to say, and they are do come up later in the eye and ear portion of the modules that are further on. So three bones of the ear or ossicles is the malleus or hammer, incus equaling anvil, stapes equaling stirrup, and function to transmit vibrations from the tympanic membrane, also known as the eardrum, across the middle ear cavity to the cochlea, and that is that one that has the shell-like appearance with the coils, which has the receptor cells that convert vibrations into nerve impulses that eventually are heard as sound. This slide is showing the internal bones of the face. So the arrow is pointing to the nasal turbinates, which are where the sinuses are lined, which help warm and humidify air, as well as try to trap any particles that are coming in. The palatine bones are the internal bones at the roof of the mouth or palate. So palatine meaning palate. There's the hard palate and the soft palate. Hard palate obviously is where the bony structures would be. Soft palate is the tissue structure at the back caudal portion of past the palate, and that is what brachycephalic breeds like French bulldogs need shortened, because that tissue basically is way too long and it hangs in front of their trachea opening and can actually occlude it where they can't breathe. So that is part of the brachycephalic syndrome surgery that is performed often, as well as widening their nares or nasal openings basically, and sacules, which we don't get into, but they have sacules at the back of their throat which can be everted, and so that's part of the brachycephalic breed syndrome surgery, and we do that often. So in this slide, it has a few features that were just pointed out in a slide prior to this. So this is a thoracic vertebrae with the dorsal spinous process. And this is showing where the articular part of the cartilage is and how the rib bone actually articulates with that, and where the intervertebral disc space is, and basically shows you exactly how that attachment to the rib is articulated with this portion of the vertebrae. So there actually is a head, neck, and tubercle, just like the shoulder joint and many others, and then the costochondral junction, where that costal cartilage is attached to, and that is something that you can actually palpate on your patients. And sometimes that is misinterpreted when they are older and they start getting arthritis at that junction as something else. I've had a patient or a client bring a patient in and they thought the rib was broken because that costochondral junction had such severe arthritis it was poking out. So that is a good slide for articulation of how the rib attaches or articulates with the thoracic vertebrae. So just some more pronunciation. So radius and ulna form the antebrachium or the forearm. So in the ulna, that forms the elbow joint. And in the picture on the bottom there, you can see the olecranon process, which is the point of the elbow, the ancanal process, which is that first notch where the trochlear notch is, and the coronoid processes are the two bumps that are distal to the olecranon process. The ancanal process is a process that in larger big dogs sometimes doesn't fuse properly and they need surgery to remove that. So ununited ancanal process is what that's called. And then you have the styloid process at the very distal end of the ulna there. On the radius, so main weight-bearing bone of the antebrachium articulates with the humerus and the ulna, and that's where that styloid process of the ulna would kind of fit in, I guess, with the radius. And then the proximal articular surface is where the radius would meet the humerus. So in this slide, it has metacarpals and phalanges and the numbering system for those. So digit number 1 being the dew claw if the animal has that digit. So counting from medial to lateral, starting with number 1 at that dew claw if they have that. And going outwards for 2, 3, 4, and 5. For the hind limb, if they don't have the dew claw, then the first digit is 2. So there's not very often that they have a digit number 1 on the hind legs of dogs. And so just remember it's starting at 2, 3, 4, 5. And also that the phalanges are proximal, middle, and distal. So P1, P2, P3, and that on the dew claw, if they have that, then they just have a proximal and a distal phalanx. So some more pronunciation of words for the pelvic or pelvis. So there's the three fused bones, which is the ilium, ischium, and pubis. Pelvic symphysis is right down the middle. And then the acetabulum is basically another name for hip socket. So that is where the head of the femur fits into the pelvis to form that ball joint. So acetabulum. And then the two large holes that help with um, relieving some of the weight of that pelvis is the obturator foramen or foramina, and those are those two holes there. Wing of the ilium are the two projections that you can feel if you're on the dorsal surface. So standing above a dog looking down, that you can feel on both the right and left sides. And for anesthesia, if you go to a place that does epidurals, these are the landmarks for an epidural, along with a sacral joint, basically, that you place your hands on the wings of the ilium, and then your fingers kind of find this divot that's in the sacral area. So the wings of the ilium become important for that in trying to locate your epidural space to do epidural analgesia. So for the femur, important things to remember is those condyles are found on the distal end of the femur at the caudal surface. So you would have to turn the animal around so you are facing them looking at a caudal view, and the two large bony knobs are what those condyles are. The epicondyles are found on top, so epi meaning on top, and those are laterally projection. So you can feel those more on the sides, so medial and lateral. But the condyles are at the back, the caudal surface, and they articulate with the tibia. Trochlea groove is the articular groove where the patella basically rides in that joint. So that groove is a hollowed out area where the patella is able to ride along that surface. And as I had said before, um, one of the reasons smaller dogs have medial luxating patellas, so it tends to luxate the patella medially. One of the reasons is because their trochlea groove isn't deep enough, so that patella can just easily skip out of that groove, and they tend to go medially. And the other reason can be that the ligaments holding the patella in place have become stretched, or maybe were never strong in the first place, or all of the above. So they have weak ligaments, or maybe their ligaments have been weakened because that trochlea groove is not deep enough, and they've had several episodes of that patellar ligament being stretched from the patella, constantly moving medially. So medial luxating patella, or MLP, is a surgery that's also done, and there's several different ways to do it. You can get knee replacements, or at a less sophisticated level, they can deepen that groove with certain instruments. So the fibula, um, fibula is the parallel bone that is on the lateral surface of the tibia, is non-weight bearing, and it serves as a muscle attachment. So this is one way that you can tell for x-rays, say if you did not label your x-rays properly, what view you are looking at. If the fibulas are on the lateral sides, then that's one way that you can tell what surface you're dealing with in terms of the tibia. So in this picture, there's the patella, the head of the fibula, the tibial crest. Tibial tuberosity is also in there, it's just not labeled. Then the shaft of the tibia, shaft of the fibula, and at the bottom, I don't believe you had to know these, but for fun, the medial malleolus and the lateral malleolus. And those are articular surfaces basically to the tarsal joints. Just going to run down a few of the common key terms and basically just pronounce them for pronunciation only. I'm not going to go through all of them, and some of them on this list are not necessarily words that you need to know. But so start with acetabulum, anconeal process, antebrachium, articular cartilage, brachycephalic, calcaneal tuberosity or calcaneus projection, basically, calciotropic, calcitonin, caniculi, coccygeal vertebrae, coccyx, condyle, costochondral junction, epiphyseal fracture, epiphyseal plate, epiphysis, Haversian canal and Haversian system, hematopoiesis, which I've said a couple times, hyoid apparatus or hyoid bone, intramembranous bone formation, ischium, lacrimal bone, malleus, obturator foramen or foramen, occipital bone, olecranon process, palatine bone, parietal bone, phalange and phalanx, sacral vertebrae, sacroiliac joint, sacrum, scapula, stapes, I'll say thoracic vertebrae and thoracic limb because I hear thoracic sometimes. Tympanic membrane, visceral, zygomatic, xiphoid.